Welcome. Have you ever heard of transverse myelitis? It's a rare but serious neurological disorder that affects the spinal cord. In this video, we'll explore what transverse myelitis is, what causes it, how it's diagnosed, and what treatment options are available. Join us as we unravel the complexities of this condition. So, what actually triggers transverse myelitis? The exact cause is often unknown, making it idiopathic in many cases. However, it's believed to be an autoimmune response where the body's immune system mistakenly attacks the spinal cord. This immune attack can be triggered by various factors, including viral or bacterial infections such as herpes viruses, enteroviruses, or even respiratory infections. In some cases, it can be associated with other autoimmune diseases like multiple sclerosis, lupus, or Sjogren's syndrome. Rarely, it can also be associated with vaccinations. Let's dive into what happens in the body during transverse myelitis. The inflammation of the spinal cord, mainly affecting the myelin sheath, disrupts the communication between the nerves in the spinal cord and the rest of the body. Myelin is the protective insulation around nerve fibers, and when it's damaged, nerve signals can become weak, distorted, or even blocked completely. This disruption in nerve signaling leads to the various symptoms experienced by individuals with transverse myelitis, impacting motor function, sensory perception, and autonomic functions. Transverse myelitis is quite rare. Accurate incidence and prevalence numbers are difficult to obtain due to variations in diagnostic criteria and reporting. Estimates suggest that it affects approximately 1 to 8 people per million per year. It can occur at any age, with peaks in childhood and adulthood, typically between the ages of 10 and 19, and then again between 30 and 39. It affects both men and women equally. The symptoms of transverse myelitis can vary widely depending on the severity and location of the inflammation in the spinal cord. Common symptoms include weakness in the legs and arms, which can range from mild difficulty walking to complete paralysis. Sensory changes are also frequent, such as numbness, tingling, burning sensations, or sensitivity to touch. Many individuals experience pain, which can be localized in the back or radiate down the limbs. Bowel and bladder dysfunction are also common, leading to urinary or fecal incontinence or difficulty emptying the bladder or bowel. Some may also experience band-like sensations around the torso. Diagnosing transverse myelitis involves a comprehensive evaluation. The process typically begins with a thorough neurological examination to assess motor strength, sensory perceptive reflexes, and coordination. Magnetic resonance imaging, or MRI, of the spinal cord is crucial to visualize inflammation and rule out other conditions that can mimic transverse myelitis, like spinal cord compression or tumors. A spinal tap, also known as a lumbar puncture, is often performed to analyze the cerebrospinal fluid. Looking for signs of inflammation or infection, blood tests may be conducted to rule out underlying autoimmune disorders or infections that could be contributing to the condition. These tests help doctors confirm the diagnosis and identify potential underlying causes. While there isn't a formal classification system for transverse myelitis based on subtypes, it's sometimes described in terms of its presentation and extent. Acute transverse myelitis refers to a rapid onset of symptoms, developing over hours to days. Subacute transverse myelitis describes a more gradual onset over a period of weeks. Incomplete transverse myelitis means there is some preservation of sensory or motor function below the level of the lesion, while complete transverse myelitis indicates a total loss of function below the level of the inflammation. This distinction helps to understand the severity and potential for recovery. Treatment for transverse myelitis focuses on reducing inflammation in the spinal cord and managing symptoms. High-dose intravenous corticosteroids, like methylprednisolone, are often the first line of treatment to suppress the immune system and reduce inflammation. Plasma exchange, also known as plasmapheresis, may be considered in some cases if corticosteroids are not effective. This procedure removes harmful antibodies from the blood. Supportive care is crucial for managing symptoms, including pain medication for pain management, physical therapy to improve strength and coordination, occupational therapy to adapt to daily activities, and bowel and bladder management strategies. In some cases, antiviral medications may be used if a viral infection is suspected. Currently, there are no proven preventive measures for transverse myelitis, primarily because the exact cause is often unknown. Maintaining good hygiene, avoiding infections, and managing underlying autoimmune conditions may help to reduce the risk. Research is ongoing to better understand the causes and potential preventive strategies. The prognosis for transverse myelitis varies considerably. Some individuals experience significant recovery, regaining most or all of their function. Others may have residual weakness, sensory changes, or bowel and bladder dysfunction. Recovery can take months to years, and some individuals may not experience a full recovery. Factors that can influence the prognosis include the severity of the initial symptoms, the speed of diagnosis and treatment, and the presence of underlying autoimmune conditions. Recent research focuses on identifying biomarkers that can predict the prognosis and developing more targeted therapies to promote nerve regeneration and reduce inflammation. Clinical trials are exploring new treatments, including immunomodulatory drugs and regenerative medicine approaches, to improve outcomes for individuals with transverse myelitis.